Hello there, welcome to our good nursing and medical training exam room. Here we have a seating area where students can sit and wait to be called. Here's our little welcoming booth. We have masks for you, and it is also very important that you bring along your social security card. If you do not have your social security card, you will have to go home and get it, or you will not be able to take the exam here at the school. That's very important. So this is a seating area. This is a private office. Moving right along the hallway, you will come into our exam room. Welcome to Good Nursing and Medical Training exam room. Here is primarily set for exams. There is the evaluator seat, the computer, and there is a whiteboard for her or him to write any notices relevant to the testing. We do have seating area here, 5 chairs for students who may have to do their written exam here. We have all of our supplies set up for the evaluator. She doesn't have to look so hard for them. We have our towels and our washcloths. We have our sheets. We have our shirts for dressing the weak right arm. We have pillowcases, and we have a generous supply of gowns. We also have your stockings. We have your gait belts, 2 different kinds. We supply isolation gowns. We have our denture cup and dentures, denture toothpaste, and the denture brush. They're waiting for you. And then we have the items for the bedpan skill, toilet paper, wipes, and the bedpans. We have a generous supply of gloves, medium, extra large, large, and small. We also have over here the urine supplies for checking the urinary output. It is considered a designated dirty area. The evaluator will tell you or give you a tour of the room nevertheless. Here is our bedside commode, and that's where you will empty the urine if the evaluator gives you permission to do so in this receptacle. We have our blood pressure stuff, all our blood pressure supplies. We have various size cuffs, the double stethoscope, and there is also alcohol wipes there. We have our feeding supplies here. We have our feeding supplies here, our cups, our plates, knives, forks. We have our fruit cocktail, and we have a mask for the mannequin there. Here is our diet card and wipes. We also have here pillows for your use for that skill. And then we have here basin, soap, lotion for your bathing skills, for foot care, and so on and so forth. We have our wheelchair here, just waiting for your use. We have a sink here in this room that has hot and cold water, and the evaluator will tell you where you will wash your hands. And there's a generous supply of wipes, Lysol spray, hand sanitizer, and the evaluator, like I said, will tell you where you will wash your hands. And here is our scale. And here is a waste paper basket right beside the sink. Over here on the bed area, we have one bed that has controls to elevate the head and a handrail. And we also have, this one has a crank. So this one is a little bit of um, manual labor. You have to crank the bed up, but the head controls are electric. We have a soil linen container right beside the bed. We have two actually, one here and one there. We also have a chair and a over bed table, and that's for your feeding skill or washing the patient as necessary for like foot care and bed bath and so forth. This one is a little on the heavier side, so you will have to use your muscles to push around this bedside table. We also have a mannequin here in this bed. Of course, our mannequin doesn't have a name. You will choose to give the mannequin whatever name you choose on that particular day. And this mannequin has a catheter. This mannequin has a catheter for you to do your catheter care. There is also a little call light. Hopefully we'll get something pretty to put on it so that you can recognize the call light as soon as you walk in. This room does have security video surveillance, but we do not use that for the exam. Actually, for the exam, we just go ahead and turn it right down, just like that. So this is our exam area, and the evaluator will bring you in and she will do a tour because she will set it up however she wants to set it up. We have clocks on the wall. And coming along over this way, out of the room and along the hallway, we have our restroom area. Some evaluators choose to do hand washing in this restroom area, or we have another little area right around here for hand washing as well. We have our paper, our soap, and there is a clock on the wall momentarily so that you can monitor your time for your hand washing. And that's about it, ladies and gentlemen. A little tour of our exam room. Very shortly, we will be hosting a past where you can come in and do your skills or practice your skills. And you will purchase a daily pass if you'd like to come into our room and practice. Now, our students who are generally here are our students. That is a privilege extended to you, and you will not have to pay for that. How about that? Well, there again is our skills lab, primarily for exam purposes. Thank you for joining.